most of the students, we just book a rotation and we are happy about it. That's true. But you also need to take into consideration the place you will be staying at and how you will be commuting to the place of the rotation. This is because at the end, if you don't have good public transport in that place, you will end up spending more money just using cabs and stuff like that. You always need to clear all of your um, which is required to get the onboarding process done. Different hospitals have different procedures. You will have to submit different documents. Just being uh, up to date about your medical knowledge, because at the end, people will ask you questions in your rotation about treatment, about diagnosis, stuff like that.
Hello, good morning, good afternoon, good evening to everyone. And today we have our student, Dr. Yash, with us, and he has completed step one and he's preparing for the match next year. So let's welcome Dr. Yash.
Hi, thank you for having me here. And yeah, so I have given my step one in 2020. I will be giving step two and step three in the coming days. I'll be applying for match next year. So yeah, I have like done almost say 50% of my USMLE journey, and so a big step is remaining. That's step two. But yeah, let's see. Thank you for having me.
Yeah, so let's move on to next section. So how was your experience in step one? How much you scored and what was the, challenges you faced or something you want to tell us about your step one preparation?
To be honest, I gave step one a long time ago, so it's like 3 years. But at that time, I took advantage of the COVID situation. There was a lockdown. Um, we were sitting at home. So I was like, anyways, I wish to go I like to go to the US. So why not start studying and start preparing? So I started studying for them at that time. And because I hadn't done my clinical subjects, I was in second year. So it was slightly difficult because step one, at the end of the day, though it's focused on basic sciences, the question stems are more clinical. So I had to take a lot of time. So that was a big challenge. I took 7 or 8 months to study for step one. And yeah, so that's the only challenge I faced, I guess, apart from the thing that, the lockdown situation and going to the test center and, staying there and stuff like that, because we have to wear a mask during that time and all those things. So yeah, that was my experience. I got 243 in step one. And yeah, so
Great. Congratulations on step one. So, if you can tell us about USC, which USC you have done and why you have chosen that USC and how was your experience?
So currently I have done 3 US clinical experiences. I have done 2 in Chicago and I did one with USMLE Sarthi at St. Mary General Hospital in New Jersey. So I did this one at New Jersey because I had heard from my friend that this is a good rotation. She had rotated here in the month of May or April, I think, this year. And so I heard from her and I was like, okay, uh, you have found it fruitful, then probably even I should do it. And so I applied and did the rotation.
So, what you learned in that rotation specific, what all you have learned, what experience you gained, if you can just tell us a little more about that. What you used to do at your
Yeah,
clinic or
yeah.
hospital.
I talk about. So it was primarily an patient experience, and uh, what things that are the things that are expected from us during the first year of our residency, like presenting a patient in a concise manner during the rounds. So during our med school, we are just expected to know everything about the patient and present it to our lecturers. But when you're doing rounds with doctors, you don't need to tell everything about the patient. You just need to tell specific points which are important. So that's a skill. So that is one thing which you learn after rotating at such places. Another important thing which you need to know, which is less in India, it is there, but it's not that much, is the access to electronic medical records. You need to know how to type the notes because it is important. Then you get to see everything about the patient in just one window. So that's an important thing. When you are able to maneuver through this, then I guess you will be ready to expect these things during your first year of residency. So I think this is important. Another thing which I did at this rotation was we were allowed to give presentations on different topics. So I spoke on COPD and methylhemoglobin, and also we were given online access to the morning reports and afternoon lectures, which are meant for the residents, but we were allowed to view them. So yeah, overall it was a good experience.
Oh, so apart from this experience, what all you have done during your rotation, how you used to prepare yourself? Is there any kind of a guidelines if you are going to US for doing the rotations?
Yeah. Um, I would like to talk about two important things. The first thing is, obviously, everybody says that inpatient rotations are very important as compared to some other outpatient or mixed rotations. And I agree with this fact. But if you have sufficient number of inpatient rotations on your CV, then probably doing an outpatient rotation is also good. Why? Because at the end of the day, we need to accept that in any hospital in the US, medical students are going to get less freedom to do what we want because we are a liability for them. So in an outpatient setting, you have more freedom. You can work more under doctors. You can discuss plans and stuff like that. So if you have a significant amount of inpatient experience on the CV, probably an outpatient experience might be better. It's not completely bad, which people say. Another important thing which I would like to talk about is, like most of the students, we just book a rotation and we are happy about it. That's true. But you also need to take into consideration the place you will be staying at and how you will be commuting to the place of the rotation. This is because at the end, if you don't have good public transport in that place, you will end up spending more money just using cabs and stuff like that. So keep in mind these two things, like the place of accommodation and how you will be commuting to the place of rotation after you decide where you are going to rotate.
Okay, so one more important question which we keep on hearing with our students as well, like uh, how they can prepare themselves and how it is different from India and US. Like if you are going for a rotation in a hospital or a clinic or a university anywhere, right? So how they have to prepare themselves, what they have to take care in their mind, what are the do's and don'ts for them while you are going in for rotations or USCs.
So important points, first you always need to clear all of your documentation, um, which is required to get the onboarding process done. Different hospitals have different procedures. You will have to submit different documents. So that is the number one thing I would recommend. Then obviously, like I said, the accommodation, transportation, those things. Then it's like you need to follow all the rules and regulations of the hospitals, which they have set. Please don't, try to take these systems for granted, because even if you get one black mark on your, CV or something like that, if the person is not happy with you, then probably you lose that chance of that getting LOR, probably. So yeah, that is one more thing. Then just being up to date about your medical knowledge, because at the end, people will ask you questions in the rotations about treatment, about diagnosis, stuff like that. So these are the only things which are necessary as far as the rotations are concerned. Apart from that, how will you be spending your time when you're not at the hospital? So each and every person has a different way to approach that. So yeah.
Yeah, thank you so much, Yash. And do you want to give any tip for future applicants, how they can search the USCs? What is the best way? How to find the USCs? Because they have the problem in finding the USCs. So any tips
Yeah.
for them?
Yeah. So this is a problem which has severely increased after COVID. Like I have heard people saying. So like in universities, it's getting difficult to get experiences. So people are turning to, USMLE Sarthi and other uh, agencies or third-party people. So what I would recommend is first is the quality of the experience. Like if you have any friends which you have rotated over there, and then ask them how was their experience. If they liked it, then you can go for it. I would suggest using this method because sometimes you don't end up getting the experience you wanted. Sorry, you end up getting the experience you didn't want. Like I have heard a few people who got bad experiences with some other people. So you have to be very, very sure about where you want to rotate, especially if you hear from somebody else, it's good. And obviously, my experience with Sarthi was good. So I would at least recommend this rotation if anybody wants to do it. And that's the only thing. Like I don't see how you can just guess how you will get a good experience just from sitting in some other country and doing online searches. I mean, websites can be attractive, but there is no way you can know. So that's the only thing I can say.
So, one more question. Sorry, this is the second last question.
Yeah,
So most of the so most of the IMGs find it very difficult, and they have the question like how and when we should ask for the LORs during the rotation.
Uh, it's just difficult. Like for example, a few people I know were rotating during the end of the ERAS application like in September, and they required an LOR because uh, if they asked in the last week for the LOR, it would take some time to get processed, and then it would be late. So these people they asked for it earlier, like during the second week of rotation. But from what I have heard, most of the people ask for an LOR, at least put the idea of a letter of recommendation in the third week, and finally, get down to the nitty-gritties and, ask them politely in the last week of the rotation. But I would not recommend it during the first week, definitely, because you haven't created any impression and it probably would create a negative impact. Like you're just there for an LOR, so what's the
Thank you. It's a very good insight for other IMGs. So the last question: how was your experience with Sarthi, starting from the booking till the rotation?
It was a smooth process. So that is a very important thing that people should know because a lot of times you end up, getting into some sort of trouble and you are just scared back at home. Like, what is happening? Why I'm not getting a response, something like that. This thing didn't happen. The entire process from start to end was a very smooth process. So kudos for that. Then the other part of the thing, the actual hospital experience, it was pretty good. Like I said, I was given access to the EMRs. I was rotating with the attending doctors. I was given online access to all the things which the residents use. So it was a nice experience, and like people can do it if they want to do it. It's a good one.
So thank you so much, and all the best, and congratulations for match you are going next year, and all the best for step 2. Thank you so much.